It basically evolved from lithotripsy. So some of you may or may not know what that is, but that is the device that breaks down kidney stones, which has been around probably almost 40 years. So in Germany, they decided to look at lower power settings because they wanted to investigate, so this device has, destructive properties when it's breaking down kidney stones, but what if we, went lower on the power? Can it potentially actually have healing capacity? And they did find that. And as a matter of fact, probably some 20 years ago, by lowering the power, they found that it actually healed non-union fractures of like the femur. And if you get a femur break, basically your thigh bone, it's very difficult to heal that. So they found that that device actually had amazing capability to do that. So, and over the years, using animal studies and human studies and all of that, and a whole slew of papers came out, and ultimately the mechanisms were elucidated to actually increase your own stem cell production. And, pretty much everyone is, most everyone has actually heard about stem cell therapy. It's pretty much everywhere. Lots of clinics are doing stem cell therapy, both for using your own fat or blood. Most recently, it's been in vogue to use umbilical cord stem cells and amniotic stem cells and exosomes and so forth. So those procedures definitely work. I actually am trained in doing stem cell therapy. I was one of the first doctors at the American Academy of Anti-Aging Medicine got certified. This was probably, 14, 15 years ago. But even today, it is still, more of a bit of a pricey endeavor to do stem cells. And there are risks, especially if you're using stem cell sources that are not your own, that small possibilities of infections and all of that. So the true benefit of our device is it actually enhances your own stem cells. And it has a whole host of other mechanisms. It is anti-inflammatory. It increases new blood vessel growth. It is actually has components of being broad spectrum anti-pathogenic, meaning that it can, kill a lot of, unwanted viruses, bacteria, parasites, all of these different things. It increases the healing capacity by releasing a whole host of growth factors, even nerve growth factor and what have you. So we found, that it has a multitude of uses. We actually have FDA clearance after about $37 million paid by the company to, acquire about 47 use patents for the device. It was a very long road, but we finally got the FDA clearance for treatment of musculoskeletal pain, also healing of diabetic foot ulcers, and we most recently got FDA clearance for treatment of burns. So amazing device. We have probably 150 or 160 providers nationwide. We've been featured on the Doctors last year. A number of pro teams use our device, the Cubs, the Indians, the Lakers, Steelers, etc. We have a good amount of testimonials from the pro teams, also from golfers, whole host of things. Some of the off-label uses of the device are myriad, but some focusing on treatment of erectile dysfunction. So that is what is probably been most popular for its uses probably over the last 5 years. Amazing results with that.
Michael,
Also,
it might be a good time to talk about how your Shockwave is different than the ones that are mainly advertised for.
absolutely. So there are competing companies. However, ours is the only true Shockwave device. Again, derived from, basically ours is a mini lithotripsy device. So if anyone has ever seen, the lithotripsy device for treatment of kidney stones, it's a huge kind of a glass enclosed bulb that's probably like a foot across, and it generates a shockwave. It's like a lightning bolt, and when it hits, you actually see this flash of light. So ours does that. Ours is about 2 inches across, and it generates that same beam of light. Now, some of the other companies out there have created what are called pressure wave devices. They're more mechanical, whereas there's a piston in there, and that actually causes micro trauma to the body. So it's very useful for orthopedic conditions and so forth. And the way that works is obviously when the body is injured, the body goes into healing mode. So that device, from the competing companies with the pressure wave device, it creates little micro trauma. So it's locations where it can be utilized are less, and it is actually quite a bit more painful to use those devices. Ours, on the other hand, does not actually cause micro trauma at all. It more in layman's terms, it actually kind of tricks the body into thinking there's an injury, thereby making the cells, more what we call permeable. So when those cells get this, this little pulse wave, then they send out the messengers that say, hey, there's a potential injury here, even though there's no real injury. But then the body sends all the stem cells, all the growth factors, all of these things to promote healing. I've utilized it on over 500 patients. Just generally, even after one session, most people experience at least a 50% reduction in pain, if not a 90 to 100% reduction in pain. So, and it's after really only about a 10-minute session. Just amazing testimonials. When we were demoing this at the American Academy of Anti-Aging Medicine at one of the big conventions, of course, we had a booth there. We had numbers of people coming through, and we just had people, they coming in with pain, and then we would treat them after that one session, and they were like, wow, this I've had this pain for 5 years and no one has been able to successfully treat it, and this device did it in about 10 or 15 minutes. So pretty impressive what it can do. If you guys visit our website, you'll see there's lots of testimonials, lots of research. The device can be used in, the aesthetics industry, the orthopedics industry. In Europe, they're doing studies to treat Alzheimer's, and they're showing some improvement in cognition because our device can actually be used on someone's head because it's not creating trauma. So its mechanism is increasing blood flow from, our realm with Dr. Lewis and myself, especially with, the advent of the initial book that Dr. Lewis and Dr. Trent wrote, The End of Alzheimer's. One of the true underlying factors of Alzheimer's is subacute infections like Lyme disease and Epstein-Barr virus and toxoplasmosis and chlamydia and mycoplasma and a whole host of these things that are really, really difficult to treat. So, and they embed themselves in the brain. So the use of this device, because it has what we call antimicrobial, and actually enhances the antimicrobial peptides in the body that are, like I was saying before, are very broad spectrum antipathogenic. So that is one mechanism over time that that they are finding in Europe, in addition to increasing the blood flow and increasing new nerve growth. So very, very exciting where this device at this point it's been used in Europe for 20 years. And now it's really pretty much in the last 3 years has just been introduced here. One of the really exciting things, well, there's several, but in the opioid crisis, the vast majority of people, are on opioids because of surgery. So they have surgery, they are placed on, narcotics to treat the pain. And unfortunately, a number of individuals, get dependent on that. So we know we have an opioid crisis. The beautiful thing about this device is even before or after it can be utilized, but we're trying to introduce it to surgeons to utilize it right after a surgery and when they're closing up the wound, because a couple of things. They found that the scar is reduced markedly and the necessity for narcotics is reduced by about 75%. So that's pretty exciting. Even after, let's say, someone who has been on narcotics for a while and they have chronic pain that generally can't be addressed easily, our device again shines because, 1, 2, 3 sessions generally is enough. But I tell people everyone has different etiology of pain and length. So I like to say 3 to 6 sessions are kind of the magic number, but it's been incredibly effective for, treating that pain. And then ultimately someone can, slowly be weaned off of our narcotics. So again, just a whole host of things.
Michael, let's segue to a testimonial and show Ross Mason. You want to describe?
Oh, yes. So this is very exciting. And this happened quite a number of years ago where we utilized the device on a spinal cord injury patient. And you can just see his testimony here.
Right now.
I was injured on August 2nd, 2007 in a bicycle accident. I was training for the Ironman in New Zealand and a bee got in my helmet. As I was going out of the arrow position, it stung me and I involuntarily pulled in my elbow and shut off the Silver Comet Trail here near Atlanta and broke my neck. And I was rushed to Grady. Actually, Sanjay Gupta, who's a wonderful physician, ended up being my surgeon, the CNN reporter, the Sanjay Gupta MD, and the prognosis was not good. I was classified as a complete injury, as a C6, which meant in my case that I would never have any function or sensation, according to my doctors, below my collarbones for the rest of my life. So I'm in my 7th year, and I met the leadership of TRT, John Warlick and Robert Warlick, through former U.S. Senator Max Cleland, who's a triple amputee, that they were helping with his shoulder injury because his shoulder is the only thing that he uses to move himself around. And it was very highly recommended. And I actually had a sore on my foot, and I have a hyperbaric chamber, but it wasn't healing. So the TRT team came in, and it healed within days. I mean, it was just absolutely incredible. And then we talked about the possibility of treating my spine, which we did. And 4 or 5 weeks later, I started sweating down to my waist. My autonomic nervous system was reactivated. And after about 7 or 8 weeks, all of a sudden I woke up one morning, and I'm a follower of Christ. I had this wonderful man pray with me for about 3 hours on a Sunday. I woke up the next day on a Monday, and all of a sudden I could do this. I could move my stomach muscles, my back muscles, turn side to side, do sit-ups, do crunches, mini crunches. And then at the end of the year, this is all at the end of 2012, in a 2 to 3 month period, I met with my primary care physician, and he put the stethoscope on me, and he asked me to breathe deeply, take a deep breath, which for me used to be, and then cough. And all of a sudden, I'm breathing in and out, and he's freaking out. He said, your lungs are working, your diaphragm is working. He said, this is medically impossible. I can't believe you're moving your stomach muscles, your back muscles, you're going side to side, you can touch your toes and come back up. And then he lifted up my legs, I can now push out 65 pounds with my legs. All of which, he said, Ross, this is absolutely medically, scientifically impossible. I can't understand it. I can't explain it. And I said, well, I think it's the wonderful TRT technology and the people I've been working with there. And most importantly, I believe, honestly, it's prayer. And I believe the Lord's already healed me, and it's now manifesting itself in my body. But I know that the team at TRT is the most important medical, clinical, scientific, and rehab effort in my healing and recovery. I work with the wonderful folks at Project Walk in Atlanta, who've done a phenomenal job with my rehab and helped me keep muscle tone, etc. But I believe TRT is the single most critical technology and effort, process, intervention in my healing. I believe the most important thing is prayer. But I believe TRT has been a tremendous answer to prayer, and I'm very grateful to that, for that, and to them.
We appreciate that, Ross. Thank you very much.
Michael, anything else you want to add?
So, yeah, I mean, obviously that's quite exciting. And I met him, and wonderful guy, and he's still doing quite well. What's coming up, the chief medical officer for the entire company out of Germany, his name is Dr. Wolfgang Schaden, and he's in Austria. He's a trauma surgeon. So he started with the company about 20 years ago. And, of course, was, just impressed beyond belief. And now they are going to be doing studies on paralysis. So at every trauma hospital, there are 11 trauma hospitals in Austria. So everyone who comes in with a spinal cord injury, and of course, they're going to be doing this as a study. So 50% will get the treatment, 50% won't. But as soon as they come in with a spinal cord injury, they will be treated with the device because it stops, the inflammation, it stops the swelling, it decreases the inflammation. But more importantly, it is going to markedly increase the stem cell migration and increase new blood vessel growth and increase all the nerve growth factors to help to prevent the paralysis. So they feel that they should be able to prevent at least 50% of the paralysis in those victims. So that's a very exciting study that's going to be starting very shortly.
Michael, right now I have some pictures up from the website of the diabetic neuropathy.
Right. So yes. So the pictures, speak volumes, of course. So this device, just unbelievable what it can do, in just a whole host of arenas, of course.
Yep.
So I would say the only downside to our device at this point, and all of them for that matter, is that insurance just has not caught up with it in terms of wanting to pay for it, even though, we have, statements from United Healthcare and all of these, insurance companies that have obviously been exposed to this technology by the numbers of doctors that have utilized our device and called to try to get this covered by insurance. But it is still an uphill battle, unfortunately. But we're hoping that, in the next year or two, it will be covered. With the treatment of the diabetic foot ulcers, I think that will probably be the first successful arena that's going to be covered by insurance. It's been tested out there a little bit over the last year. Medicare has, for a couple of providers, had a little bit of a trickle in terms of reimbursing, but it's taken over a year for that doctor to get reimbursed because they asked for just a ridiculous amount of information. But hopefully, as more doctors, who own our device talk about it, the insurance companies will get into gear and pay for that. But as it stands now, the treatment sessions run generally from about $100 to, $250, $300 a session. So it's not too pricey. The vast majority of people, find that to be a comfortable number. And again, depending on the indication, like for pain, usually from 1 to 3 sessions, maybe up to 6 sessions. Diabetic foot ulcers definitely need more like 12. And then everything in between. The erectile dysfunction is usually around 6 sessions. But again, they're just a multitude of protocols depending on what is trying to be addressed.
Michael, so with erectile dysfunction, you're obviously increasing blood flow. Do sperm counts go up? Do things like testosterone pop up as well? Or what do you?
Absolutely, yeah. So you do actually get about a 20% increase in testosterone, and it is breaking up the plaques. It also increases the nitric oxide there locally. So you get the vasodilation. It helps amazingly well with BPH, so, larger prostates. So also after about 6 or so sessions, men who have experienced, getting up in the middle of the night, going to the bathroom 3, 4, 5, 6 times a night, after the utilization of this device, it markedly decreases to some, down to 1 time a night and some 0. Exciting in the female realm, it actually can enhance orgasms, so that's really pretty cool. It's been utilized for treatment of interstitial cystitis, which is a really, uncomfortable disease syndrome for women, and very, very difficult to treat. So our device treats that very, very well, and just a whole host of things.
No, that's very good. I'll open it up to questions now. Anybody have any questions of Dr. Carter? General questions or germane to their particular indication that they might want to get some advice on whether this would work for them or not.
Do you have any experience like with peripheral vascular disease or post-stroke victims?
Yeah, absolutely. So this device, again, like just with, the diabetic foot ulcers, obviously there's a significant decrease in blood flow in diabetes. And when you have the ulcerations, it's all of that blood flow is just severely compromised. So, so that's how it is effectuating the healing. And of course, diabetic foot ulcers are infected. So it will, decrease that infectious cause there as well. So, but yes, for peripheral artery disease, if patients are experiencing, pain or what we call intermittent claudication because of decreased blood flow, this device works amazingly well for that also. And the other part of the question was, what else?
A stroke.
So, yes, we've used it on individuals who've had strokes in the past, especially for those who have like let's say a year out and so forth, and they have contractures, so their hands or arms may be frozen, because of inability for, the communication from the brain telling their body it can move. So yes, over 6 to 12 sessions, we have testimonials of people who have gained marked mobility in those areas. And yes, just for stroke itself, again, it can be utilized to enhance blood flow.
Any other questions?
Ramona has one. You mentioned in Europe they're using it for Alzheimer's. Is that being used at all in the United States or for the intracellular infections?
Well, so we're doing clinical studies here now on the treatment of Alzheimer's. So again, Alzheimer's is very, very multifactorial. So as I'm trained also by Dr. Dale Bredesen, who wrote the second book, The End of Alzheimer's, and the classifications, have been put in, 6 different broad classifications for Alzheimer's. Type 1 being inflammatory, type 1.5 being due to type 3 diabetes of the brain or due to insulin resistance, which we talked about last week. Type 2 is decrease in hormones. So decrease in testosterone or estradiol or cortisol. Type 3 being toxic, from mercury or lead or aluminum or mold mycotoxins. Type 4 is decrease in blood flow, due to arteriosclerosis, and type 5 is traumatic. So that's where the traditional medicine doesn't serve the population well when it comes to diagnosing Alzheimer's and Parkinson's and dementia, because they don't go to all of those underlying causes that could be, driving the Alzheimer's. So
it seems like the Shockwave device covers many of those.
Yeah, absolutely. That's what's so exciting about it.
I personally think the risk is of applying that kind of therapy to, this area of the body.
Yeah. So, but again, it can be used on the head, but even just using it, we have a use patent for use on the meridians. So if any one of you are really into acupuncture and so forth, we use it on the hands and feet. So on the, the hands, palms of the hands and the soles of the feet, these areas, specific areas, correspond to various body organs. So utilizing the device for those, areas, those specific meridian areas on the hands and feet, has also shown pretty amazing results for a whole host of disease processes. We've actually even used it on individuals with decrease in kidney function. And even though it can obviously be used directly on the kidneys, but we have some initial studies that showing when we're doing it on the hands and feet, and people have actually gotten improvement in their kidney function after about 6 or so treatment therapies. As a matter of fact, Dr. Tom Liu out at UCSF, he's a researcher out there. He's doing studies and showing that it can help reverse kidney damage. So there's a whole lot of stuff that will, be coming up and, released in the coming years and so forth.
Yep. I think Dr. Carter's articulated this very well, but it fits perfectly into our model of 4 mechanisms and the thrive versus survive. Like you have a little joint pain, it's uncomfortable to you, but from your body's perspective, it's not a survival issue. Okay, so what the Shockwave is doing is maybe telling the body that it may be more of a survival issue than you think. And so it's sending this signal that there's a problem in that area. So it's literally waking up your own immunity.
Absolutely.
And this is not the only technology that does this. There's another technology that does this. It's called movement.
That is true.
But there's another technology that's called bee sting venom that has been put into joints that are painful, and then it wakes up your immune system, and your immune system then works harder to rectify the situation. So there are many corollaries to this. Obviously, exercise isn't profound enough compared to the local intensity of the shockwave therapy, but it's on the same continuum, if you will. But I think so. It's not some sort of odd, inexplicable modality of healing. So it's out there. It makes a lot of sense to the scientific community, as far as I'm concerned, in terms of how it heals and how it does these things. I had an article. I'm not sure it's completely germane, but I'm going to throw it up here just very briefly. It's all sciencey, but I won't get into the science of it. But basically it says, this article, age-related changes of normal cerebral and cardio blood flow in children and adults aged 7 months to 61 years. And what it's very clear is that, when we're young, we have tremendous blood flow because we're growing. And then as we age, we hit a balance, but it's a lot lower. And I think what this does is it opens up those channels that maybe have been, lower blood flow or dormant, that they're there. It's just a question of awakening them, if you will, more of a dormancy. That's my hypothesis based on this article. I may be a little bit off, but and Dr. Carter said VEGF, vascular endothelial growth factor, so you're producing new vessels, may be enhancing the function of existing vessels as well.
Absolutely.
Yeah, which exercise does.
Yeah, again, if you guys ever have a chance to just go to the site and look at the testimonials, they're doing just amazing things over in Germany. There's a video of them using our device in open heart surgery. So actually doing the shockwaves on an actual beating heart that was damaged by, myocardial infarction in the past. And over time, it actually increases the new blood vessel growth and healing occurs of that dead muscle. It's pretty extraordinary.
Yeah, and once again, we're all on that continuum, because the difference between having an ischemic event where you feel the tightness in your chest and, maybe you're become dizzy or something, versus someone who dies suddenly is the vascular endothelial growth factor, formation of collaterals around that blockage. And so this is doing this in advance.
Absolutely.
Okay, so very cool. Any other questions for Dr. Carter? Okay, well, those were excellent questions. That's it. We'll repeat this tomorrow night if anybody needs another bite into it. But TRT LLC, Tissue Regeneration Technologies LLC, but I'm sure you can find it if you look up Softwave Technologies.
SoftwaveTRT.com, yes.
All right, folks. Thanks very much, and we'll catch you next time.